It's 2 p.m. on a Tuesday, and you're standing in the kitchen, staring at a task you've done 1,000 times, and you cannot make yourself start it. Not, don't want to, cannot. Your body feels like it's moving through water. Someone asks if you're okay, and you say, just tired. Because that's easier than trying to explain that this isn't tired the way a bad night's sleep is tired. This is a different kind of heavy, and it's been going on for months. And somewhere along the way, you started believing it was a character flaw instead of a symptom. It usually isn't laziness. It's often iron. There's a version of exhaustion that looks exactly like a motivation problem. The missed gym sessions, the emails left unanswered, the hobbies you used to love that now feel like chores. And it has a physical cause that has nothing to do with discipline. An estimated 10 million people in the United States have iron deficiency, according to the CDC. And women of reproductive age carry a disproportionate share of that number because of monthly blood loss the body has to replace with dietary iron it often isn't getting. A significant share of the people affected have no idea because the symptom doesn't announce itself as an iron problem. It announces itself as a person who can't seem to get anything done. Here's why this one gets missed so often. The standard blood test most doctors run isn't sensitive enough to catch it until the deficiency is severe. We'll get to exactly which number actually matters, and it's not the one at the top of your lab report. First, here's where lazy and iron deficient actually diverge, because once you know what to look for, the difference is obvious. Start with the fatigue itself. Laziness, or more accurately, ordinary low motivation, tends to lift the moment something genuinely interesting shows up. A concert you're excited about, a trip, a deadline with real stakes. The energy is there. It's just not being spent on the boring task. Iron deficiency fatigue doesn't discriminate like that. It flattens everything equally, the boring task and the exciting one, because the problem isn't interest, it's oxygen. Iron is the core component of hemoglobin, the protein in red blood cells that carries oxygen from your lungs to every tissue in your body. Without enough iron, your body makes red blood cells that are smaller and carry less oxygen, a condition called microcytic anemia. Less oxygen reaching your muscles and your brain means less energy produced at the cellular level. Full stop, regardless of how motivated you are. You cannot think your way past a hardware problem, and no amount of willpower increases the amount of oxygen a starved red blood cell can carry. So ask yourself, is there anything at all, that reliably cuts through the exhaustion, even for an hour? If the answer is genuinely nothing, that's the first sign this isn't about drive. There's a physical version of this same flattening that shows up during exertion specifically, and it's easy to mistake for being out of shape. Climbing a single flight of stairs and needing to stop halfway. A heart that pounds and a breath that goes short, doing something that used to be effortless. This happens because with fewer oxygen-carrying red blood cells in circulation, the heart compensates by beating faster and harder just to move the same amount of oxygen around the body. That compensation is audible and physical. It's not a fitness problem. It's the cardiovascular system working overtime to cover for a resource it doesn't have enough of. Now look at the mental fog, because this is the symptom most often mistaken for a personality trait instead of a physical one. People with iron deficiency frequently describe losing their train of thought mid-sentence, rereading the same paragraph 4 times, forgetting why they walked into a room. Colleagues start describing them as checked out. They start describing themselves that way too. The brain uses roughly 20% of the body's total oxygen despite being a small fraction of its mass, and it is exceptionally sensitive to reductions in oxygen delivery. A 2018 study in the Journal of Clinical Sleep Medicine and multiple hematology reviews have linked even mild, non-anemic iron deficiency to measurable declines in attention and cognitive processing speed, meaning you don't need full-blown anemia for your brain to be running on a reduced supply. Lazy is a judgment about effort. This is a measurable drop in the fuel available to think. Here's a symptom that has nothing to do with tiredness at all, and it's the one that should stop you from writing this off as burnout or low motivation. Restless legs at night. An uncomfortable, crawling, almost electric urge to move your legs that gets worse the moment you lie still. This isn't a stress symptom. Iron is required to produce dopamine in the brain, and low iron stores are one of the most well-documented causes of restless leg syndrome. Well established enough that iron studies are now a standard part of RLS workups in sleep medicine. If you're exhausted all day and then physically unable to lie still at night, that combination points hard at iron, not at how hard you've been working. There's a second tell that has nothing to do with energy and everything to do with what you crave. An urge to chew ice. Not because you're thirsty, not because it's hot, but a genuine compulsion to crunch on it. This has an actual name, pica, and craving ice specifically has a name of its own, pagophagia. Researchers don't fully understand the mechanism, but it's strongly and specifically associated with iron deficiency, and it resolves, often within days, once iron is corrected. Nobody craves ice because they're lazy. Then there's the tell you can literally see. Pale inner eyelids, noticeably lighter than the surrounding skin. Brittle nails that curl upward at the edges instead of lying flat. A sign called koilonychia, or spoon nails, that shows up in more advanced deficiency. Hair that's shedding more than usual in the shower drain, sometimes months after the fatigue started, because hair follicles are among the first tissues the body deprioritizes. None of these show up because someone lacks motivation. They show up because the body is triaging a limited resource. And cosmetic tissue, hair, nails, skin, is the first thing sacrificed when iron runs short, and vital organs get first claim on what's left. There's one more overlooked sign worth naming, because it tends to arrive quietly and get blamed on something else entirely. A colder than usual tolerance. Hands and feet that feel cold even in a warm room. Iron plays a role in thyroid hormone production, and in the body's ability to regulate temperature efficiently. And people with unaddressed iron deficiency frequently report feeling cold when people around them don't. It's often dismissed as just having bad circulation, but paired with the fatigue and the fog, it's another data point pointing at the same underlying cause. So here's the test we promised. The number that actually tells you what's happening, because the one most people get isn't it. A standard hemoglobin test can come back completely normal while your iron stores are already critically low, because hemoglobin is one of the last things to drop. Your body protects it until the deficiency is severe. What you actually want is a ferritin test. Ferritin measures your stored iron, the reserve tank, and it starts falling long before hemoglobin does. A ferritin under 30 nanogram millers is considered depleted by most hematology guidelines, even when every other number on the panel looks fine. And some clinicians now flag symptomatic patients as functionally low, even closer to 50 nanogram millers. If your ferritin comes back low, you were never lazy. You were running your entire body on a reserve tank that had already hit empty. These are the signs that mean it's time to test, not push harder. 1. Fatigue that doesn't lift for anything, even things you're genuinely excited about. 2. Restless, crawling legs specifically at night, worse when still. 3. An urge to chew ice that has nothing to do with heat or thirst. 4. Nails that curl, hair that's shedding more than it used to. 5. Breathlessness, or a pounding heart doing something that used to be easy. 6. 3 or more of these, together, at the same time. Iron carries the oxygen every cell in your body runs on, and roughly 10 million people are short on it without ever finding out, because the symptom gets filed under character instead of chemistry.